They were built to do one thing: control blood sugar. But the drugs behind Ozempic, Wegovy, and Mounjaro keep doing things their inventors never planned: protecting hearts, quieting addictions, maybe even nudging cancer risk. This is the story of a medicine that outgrew its job description, and the line between what we've proven and what we only suspect starts with the biology. After you eat, your gut releases a hormone called GLP-1. It tells your pancreas to release insulin, slows how fast your stomach empties, and signals your brain that you're full. These drugs are synthetic copies that last far longer than the natural version. Semaglutide copies one such hormone, Tirzepatide mimics two. They were approved first for type 2 diabetes, and the dramatic weight loss was, at first, almost a side effect. Here's the finding that changed how doctors think about these drugs. In a large, rigorous clinical trial called SELECT, semaglutide cut the rate of major cardiovascular events, heart attacks, strokes, cardiovascular death, by about 20% in overweight patients with heart disease, even those without diabetes. That's not an observation from health records. That's a controlled trial, the gold standard. It reframed these as heart drugs that also happen to reduce weight. Then came stranger reports. People said the drugs didn't just curb appetite, they dulled the urge to drink, smoke, even gamble. A 2026 BMJ study tracked over 600,000 US veterans with type 2 diabetes and found GLP-1 use was associated with a 14% lower rate of new substance use disorders across alcohol, cannabis, cocaine, nicotine, and opioids, with further reductions in overdoses, emergency visits, and drug-related deaths among those already affected. The leading idea: these drugs act on the brain's reward and craving circuits, not just the stomach. But the newest thread is cancer. Across large observational studies, people on GLP-1 drugs show lower rates of several obesity-linked cancers. A 2026 Penn Medicine study of nearly 95,000 women, presented at ASCO and published in JCO Oncology Practice, found GLP-1 use was associated with about 30% lower odds of developing breast cancer. But observational data can only show a link. The most likely explanation is indirect. Carrying less body fat means less of the estrogen and chronic inflammation that can feed certain tumors. So, is it the weight loss or the drug itself? Right now, let's draw the line clearly, because the hype blurs it. Proven in controlled trials: blood sugar control, substantial weight loss, and reduced cardiovascular events. Strongly suggested but not yet proven: lower addiction and possibly lower cancer risk. Everything past that is hope. A responsible look at these drugs holds both truths at once. They are genuinely transformative, and they are not magic. They come with real downsides: nausea, muscle loss alongside fat loss, high cost, and the fact that for many people, stopping the drug means the weight returns. We also have only a few years of wide, real-world use. Powerful, body-wide effects deserve humility about the long term. Every so often, medicine builds a tool for one job and discovers it's a key that fits a dozen locks. GLP-1 drugs are that kind of tool. The science is still catching up to the surprise. Science. Untold, where the side effect becomes the main event.